As dedicated allies to the First Nations, Inuit, and Métis peoples, we at EduCanNation recognize the vast sovereign, unsurrendered, and treaty territories from the east to the west coast. We acknowledge the First Peoples of Turtle Island to be the original and rightful land owners, land caretakers, and land healers to what we know to be Canada. Through an ever-growing network of partners and supporters, we at EduCanNation sincerely aim to continually work and learn how to be diverse and responsive in supporting the various wellness needs of Indigenous communities. Welcome to ECN Talks, brought to you by EduCanNation, Canada's first and only association of certified cannabis educators. EduCanNation is dedicated to delivering the highest standard of responsible cannabis education, supporting respect for holistic plant medicine. We're patients supporting patients, caregivers, and a growing network of cannabis coaches and educators because we've been there, been through it, and understand that there's more to cannabis than what we've been told. Stigma, myths, and disinformation have clouded more minds than any puff of cannabis smoke. So these conversations are to help clear the air while we celebrate the plant, the people, and the science behind cannabis by sharing stories, insights, and practical guidance to help you navigate the world of holistic plant medicine safely and confidently. Whether you're here to learn, explore, or just satisfy your curiosity, consider this your monthly dose of cannabis literacy without the hype, the smoke, or the stigma. EduCanNation is here to offer straight-up education you can trust.
Hello, everyone, and welcome back to ECN Talks, Episode 2. We're pretty excited. We're going to be talking today about high-potency products, the prevalence of CHS and CUD, and our views on what exactly is going on here. We're really thrilled to be back. Many thanks to everyone that watched our pilot episode. Your support, your feedback, your questions, your comments, they really help us to bring you more targeted and thoughtful conversations that you want to hear and that you want to discuss with us. If you haven't seen our first pilot episode, you can find it on KGL Network on YouTube as well as on LinkedIn. Stay tuned, and we're hoping that our show is also going to be on Spotify soon. Many thanks to Reverend Kelly and the KGL Network for their continued dedication and support of education. It really means a lot to us. We are grateful that you love the plant as much as we do. Head on over to YouTube and subscribe to EduCanNation and the KGL Network today. JJ.
Yes, please do, because we are incredibly grateful to all our friends in the cannabis community, as well as to all our followers, our members, our advisors, partners, and sponsors over at EduCanNation. We really wouldn't be where we are today without you, and we're honored that you have put your faith and your trust in us to supply you with your cannabis education needs and to support you on your cannabis journeys.
Yeah, it really couldn't mean more to us to have such a growing community of coaches, of educators that are joining our ranks, or to have the vast array of patients and caregivers trusting us to support them through their healing journeys with cannabis. For 5 years, EduCanNation has been supporting coaches, educators, and entrepreneurs in the cannabis space. We've grown significantly in the last year. So if you're just starting off in the cannabis space, educating or coaching, this is the time to join us. You will find a lot of support and a lot of community, and really there's no sense in reinventing the wheel. We're here to help you keep your wheels going along your journey. One of our many offerings includes our business support group meetings, where we create opportunities to grow and thrive within an encouraging community, and our network of partners and advisors support us on our mission at every turn.
Yes, that was a big part of what drew me to EduCanNation. I was very much drawn to the community and to the support that was available to me when I was just getting started in the cannabis education space. I had no experience whatsoever as a coach or an educator before, the cancer came knocking on my door and absolutely changed my life. I worked for 25 years in the hospitality industry, working in restaurants. And that was, before I got this diagnosis. And, I took a little hiatus from that job. And it wasn't long before I realized that, I was here to do something more. And joining EduCanNation really, opened my eyes to what, I would potentially be capable of. And, now here I am 6 years later with co-executive director with Shawna and Marianne Lawrence of this cannabis education nonprofit. I'm a certified medical cannabis educator, along with a few other titles, and I'm making a difference in lives, which is really important to me. And, that's thanks in huge part to everybody at EduCanNation and the collective education and support that I received when I was just starting out. And, I didn't just learn how to run my business effectively. I learned how to better support my own healing and that of other people through the continued collaboration and support of my peers. So I'm really, really grateful for everything that I've learned at EduCanNation. And I hope that you learned something here today as well. And if you do, please, drop us a line, send us an email, educanationinc@gmail.com. We'd love to hear your thoughts on this subject. We'd love to hear your thoughts on what you would love to learn about. And that being said, it's really important for us to, remind you as well that, as your hosts, we are not doctors or nurses. We're actually patients first. And we've, gathered a considerable amount of knowledge over the years that we have been navigating our own journeys. And now we want to pass that information along to you. So do be advised that this podcast is for informational purposes only and shouldn't be construed as medical advice.
Yeah. And I love that. We really are patients first. We all come to cannabis, whether it's for ourselves or for our family members or a friend or whatever it might be. We've come to our learning about cannabis through our personal experiences and exploring the therapeutic benefits of cannabis. And, everything that we have done, all the work that we've done over the last few years is really about creating the highest standard possible of cannabis education and making sure that we're getting credible resources and education out to you. It's our mission to support patients because we truly, as patients ourselves, we understand how overwhelming a health crisis can be and how difficult it can be to navigate, to make decisions, to make informed decisions, and not to just be rushed into going ahead with some sort of a treatment that we're not comfortable with because we've been told that that's our only option. So we are here to teach you about other possibilities, and to help you make informed decisions.
Into this cannabis space as well. And as you were saying, most of us here are patients with all a unique story that has brought us to the plant. And being that we are still here, I imagine we've had some success with it. And that's why we are sharing this story. And, I'm just so truly grateful for this plant and for this community and all the support that, we've received and that we've given over the years to others. And we just want to take this time to thank everybody from the bottom of our hearts for all the support. And thank you to this incredible plant, Cannabis, to the Earth Mother who provides her. We are just so in love with this plant and for sharing it with you. We're grateful that you're here with us.
Yes. And, before we continue a little bit more oozing about who we are and what we do and why we come here today, we're here today because within our organization, we have a lot of these conversations. Obviously, we need to stay up on top of what's going on out there in the cannabis space. And today's topic about CUD and CHS have been sort of hot topics around our water cooler within the organization. And we'd like to discuss why we think we are being affected by these new conditions, because I don't remember hearing about them years ago when I first started in the cannabis space. Mm-hmm. And that brings me to welcoming our next guest, who is a member of our board, Janna Champagne. Janna has actually written some very interesting articles and done a lot of research herself on these topics. So I'm really excited to dive into these topics.
My name is Shawna Champagne. I am a board member of EduCanNation and working on a lot of amazing education offerings. So stay tuned for those announcements. My background in the cannabis industry began as a patient who happened to be a nurse when I had a complete health collapse in 2012. and I was seeking alternatives to opioids for extreme and chronic pain. And as a nurse, I knew I didn't want to go down that opioid death pathway. I had seen too many patients, meet their demise by choosing that option. But I went on to be very surprised that the cannabis did so much more than just alleviate my pain. It helped me sleep better. It improved my quality of life. It improved my function. It got rid of my brain fog, which is the opposite of the stigma, for example. It also, within about 6 months of intensive use of cannabis concentrate, I had my lupus labs seroconvert, meaning I went from positive for lupus to negative for lupus. And as a nurse, that got my attention because this is not an expected outcome with the mainstream approach, which, by the way, I'd followed the mainstream approach for lupus for about 18 months before starting cannabis and didn't see, any improvement whatsoever. So this really got my attention, and I began to deep dive into the research to try to understand my own outcomes. And it was sort of a self-dialectical journey to learn all of this science that I was never taught in nursing school. I was never taught in graduate school to become a family nurse practitioner. In fact, it was 8 straight years of school and the topic never came up. And it was all medical curricula. So this, just struck me as there's something really wrong here. I need to understand this. While I continued to improve, a few years later, my daughter with autism suffered a puberty crisis, which is common to about half of kids with autism, where almost overnight she began to elicit really severe behaviors. And this included self-injury, it included aggression towards others, it included property destruction. So really severe crisis, very stressful time for my family. And when I weighed the risks versus the benefit of all the options for her, which included pharmaceutical antipsychotics with horrific side effects, not only quality of life impairing, but potentially life-threatening side effects of the pharmaceutical route for autism, cannabis was clearly the more safe option. And I also learned it's potentially more beneficial because it has, the ability to fill in what we call endocannabinoid deficiency, which I know we'll talk about more later. But endocannabinoid deficiency is actually part of autism. So cannabis works more deeply than just managing symptoms, which it's amazing at doing. So that's sort of my journey and how I got here. Currently today, just through a very organic process where I became a patient, then a grower, then a patient consultant, and then a medical professional educator. I currently serve as a professor at John Patrick University in their integrative medicine program, teaching cannabinoid science to medical professional students. I'm also founder of 501c3 Autism Safe Haven, a nonprofit committed to creating cannabis-inclusive autism care resources because they do not exist. That's, amongst other things, I'm also, I retired my nursing license in 2022 in boycott of unethical cannabis policies in my state. And I became board certified as a master herbalist. So I still see patients through that. And of course, doing lots of great work through EduCanNation and this collaboration to really bring this education to those in need. So thank you, everybody, for being here today.
Yeah, thank you. Thank you for all the work that you do, for all your advocacy, for being a part of our board and for sharing all of your knowledge. It helps us grow together. And so let's dive in. Jay, can you explain to us what is cannabis use disorder, or CUD?
Yeah, for sure. Just really simply, it's defined as a problematic pattern of cannabis use leading to clinically significant impairment or distress. And it's manifested or based on a list of criteria that is put out by the DSM-5, and that's the Diagnostic and Statistical Manual of Mental Disorders. I only just learned about this when I was in Virginia at the Patients at a Time conference, and they spoke a lot about cannabis use disorder, and I'm going to be bringing up some of the points. But this criteria for cannabis use disorder is about a dozen topics, but we'll probably just look at the top 10. And these are the criteria that determine whether you have a cannabis use disorder. So I thought it'd be good to go through it, and then maybe even at the same time we could each take a little tally to see if potentially we might, fit the criteria for a cannabis use disorder. So I'll let us all take our own individual tally. But so first of all, the first criteria is that cannabis is often taken in larger amounts or over a longer period than intended. There's also a persistent desire or unsuccessful efforts to cut down or control the cannabis use. The third criteria is that a great deal of time is spent in activities necessary to obtain, use, or recover from cannabis. Also having cravings or a strong desire to utilize cannabis. Recurrent cannabis use results in a failure to fulfill major role obligations at work, school, or home. The sixth criteria is continued cannabis use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by its effects. The seventh is important social, occupational, or recreational activities are given up or reduced because of cannabis use. Eighth is recurrent cannabis use in situations where it is physically hazardous. Cannabis use is is continued despite knowledge of having a persistent or recurrent physical or psychological problem likely to have been caused by or exacerbated by cannabis. And then having a tolerance, I guess a high tolerance, would also lump you into that criteria. So I don't know if how many of those apply to us here. Did anybody get more than two?
Yeah, well, I think I could definitely fit myself into a couple of those for sure. How about
And
you?
it's only two that you need to that will cover you for a mild case of cannabis use disorder.
What about yourself, Janna?
I didn't count. I'm actually trying to count now, but yeah, I have at least two. So
Okay. And when I was in Virginia, a lot of the doctors also stated that they were diagnosed with a cannabis use disorder. No, these are medical cannabis doctors who utilize cannabis. Some of these, like, sure, I could fall into the category, and then some of them just don't quite feel exact. Like the first one, cannabis is often taken in larger amounts or over a longer period than intended. Well, yes, of course, I never intended initially that I would be taking these high doses of cannabis that I am taking to treat cancer. So yes, I never expected that, but I definitely do use the medicine intentionally, and I am going to take it for a very long period of time, most likely my whole entire life, which will hopefully be many, many, many years. So that might lump me into that criteria because I have a condition that requires constant medicating with cannabis.
Yeah, and what about number two? Like, there's a persistent desire or unsuccessful efforts to cut down or control cannabis use. Obviously, you're not wanting to cut your use down. It's saving your life. It's keeping
Exactly.
you. And
So
all three of us, I know, fit into number three because we all spend a great deal of time in activities necessary to obtain, use cannabis, right? We all grow our own cannabis.
Yep.
It's very
and make our own medicine.
And process. Yeah, concentrating and the making of edibles or tinctures or whatever it is, that works for you. It does take a lot of time. So, it just goes to show you, just about anybody could be diagnosed with this, but it doesn't necessarily mean that their use is pathogenic, meaning unbalanced or unhealthy. It's large amounts are sometimes needed depending on the situation or diagnosis. Autoimmune is one of those diagnoses. I've taken upwards of 100 milligrams of THC every single day for more than 10 years. I'm more functional than I was when I began that regimen. By far, I went from being labeled totally and permanently disabled in 2013 to working 65 hours a week today. Fully functional primary caregiver for my daughter, plus doing all of these other things. So just because it fits doesn't necessarily mean that it's a problem, if that makes sense.
Maybe we need to really focus on separating medical use from cannabis use disorder, right? Some of us, like my son, would definitely fall in, to this diagnosis. He uses it regularly for epilepsy, but if we took it away from him, well, he would likely have seizures again, right? Just, Jay, when you stop taking your cannabis.
I ended up with 11 tumors in my brain.
Exactly. So let's all just take a moment to think about our relationship with cannabis and consider these criteria and how they make us feel while we take a commercial break.
Awesome.
of the biggest areas for growth in the cannabis industry is actually cannabis hospitality. And did you know you can start your own business for under $5,000? Allow me to take you through my mentorship program to receive your cannabis hospitality stewardship certificate, where we're going to allow you to understand this plant in a way in which you can actually shepherd the plant to people. And not only a way to start a new career, but a way to actually enrich people's lives so they can use the benefits of cannabis to enhance their lifestyle. Please join me on this revolutionary journey.
EduCanNation, a Canadian non-profit organization devoted to improving the quality of cannabis education and care across our nation and around the world. EduCanNation believes in continued education and support through the three-tiered membership: cannabis education and outreach services, patient education and support through their holistic clinic model. EduCanNation, providing the highest standard of professional and responsible cannabis education. www.educanation.info.
All right, welcome back.
Welcome back.
We are talking about cannabis use disorder. We are here with our guest, Janna Champagne, and we are diving into the next part of this conversation. So let's talk a little bit more about cannabis use disorder. Let's talk about, what we're seeing. Apparently, it's affecting somewhere between 9 to 30% of people who utilize cannabis. But I mean, that 30%, that feels high to me.
Yeah, and I wonder if it correlates with medical use, right?
Mm-hmm.
If we're just, those who are self-medicating perhaps are being diagnosed.
Absolutely. And when I was in Virginia, it seemed that there were so many people, getting this diagnosis that it was basically, if you went to your doctor and said, "Hey, I utilize cannabis," they went, "Oh, cannabis use disorder."
That's one of the problems in medicine today, because we're not educating our medical professionals. They don't understand the endocannabinoid system science. They don't understand cannabis therapy. Even appropriate medical use might set off some flags for them. And this really it's overdiagnosed. I believe it's a hallmark of the lacking education of our physicians. So I tend to teach medical professionals, if you aren't competent to guide patients to optimize their medical cannabis therapy outcomes, you should not be diagnosing them with the cannabis related disorder, because oftentimes what that patient is lacking is competent education and guidance. And oftentimes we can help to alleviate any of concerns around cannabis use simply by helping them understand that, maybe using non-intoxicating compounds during the day would be, better for their function. So maybe shifting up the scheduling and using the intoxicating compounds at night would be appropriate. All of this should come with that appropriate guidance that is required of medical professionals to uphold our ethic of informed consent as well. So it's very, very important. And we're really, we've really dropped the ball in the cannabis industry as far as really serving our patients appropriately. And this is just one example of that. So.
Yeah. I'd like to share a little piece from one of our other board members, who I believe has received a cannabis use disorder diagnosis as well, and just her own personal feedback on it, because I think it touches on what we've been speaking about. So she says that she's always found cannabis use disorder to be a curious phrase, like a diagnosis searching for a villain. And I kind of like the way she phrased that.
Mm-hmm.
People who use cannabis don't get to tell their own story. They get diagnosed. You can explain why or how you use it, what your outcomes are. But if someone's already decided cannabis is the root of all your problems, there's no conversation left. Mm-hmm. And then she goes on to say that, meanwhile, we're surrounded by socially accepted dependencies: caffeine, alcohol, online shopping, validation from strangers. Compulsive scrolling rewires our neurotransmitters with a single puff of smoke. We all use something to manage the constant static of modern life. My tool just happens to be green, aromatic, and criminalized for most of modern history. And she goes on to say that for me, it's not about escaping reality. It's about choosing when and how to engage with a world that can be relentlessly loud, polluted, and performative. She lives in Toronto, where the air hums with traffic, construction, and sirens, planes, circles overhead every few minutes, and a neighbor with no trees still finds a reason to use a leaf blower. Cannabis allows me to stay functional and kind in an environment that's anything but quiet. I think that sums it up pretty nicely.
And self-medicating is medicinal as well. You know, I mean, Dr. David Allen makes a beautiful point in his video on the endocannabinoid system. It's a 3-minute video on YouTube. We can link it if you'd like. But he talks about how even people who think they're using cannabis recreationally are receiving medical benefits from its use, because it's naturally going to come in and promote balance in their system. So I feel like most of these people that are using cannabis recreationally are actually treating an endocannabinoid deficiency, which makes daily and sometimes heavy use completely appropriate. So.
And do you think also that maybe just like the current landscape of the market and how we've been moving towards higher and higher concentrated THC, that, you know, in the recreational spaces, is that potentially affecting? Sorry, I'm not really quite sure what that noise was.
That was pretty loud. Ask your question again.
Yeah. Do you think that the current recreational landscape, let's call it, like the products, the change in products we've seen over the last couple of decades, just a massive increase in the percentages of THC in our products and what we have access to? Do you think that that is affecting this diagnosis, this increase in diagnosis?
I do. I think the way we have treated the cannabis plant, it's funny because I'm in the United States, I'm in Oregon, so it's a little bit different regulations and whatnot. But in the United States, I feel like there's this dichotomy where cannabis is both severely overregulated and also severely underregulated. And it's overregulated as far as the access, because this plant has an unsurpassed safety profile, and being able to utilize it should be a basic human right, considering our endocannabinoid system and all of that. But it's, it's so interesting because at the same time, we're very underregulated, and we allow advertising terms that maybe don't really reflect what the plant actually is. We allow all kinds of tweaking and, synthesizing and semi-synthesizing and isolating. And excuse the term, but I use the term bastardization of the plant. And what we're doing is we're taking this cannabis flower that has 500 compounds, mostly medicinal, that has evolved with humanity for well over 5,000 years. We don't even have an exact number yet. But we know that this plant is meant to help keep our bodies in balance. And the underlying cause of all illness is imbalances. So from that perspective, we can see how it's a benefit to humanity. But unfortunately, we have people coming into this industry that are following the dollar signs. And in order to monopolize profits, they need to patent a cannabis product because the plant is not patentable. Mother Nature holds that patent and she's not selling out. So they, in their drive to make lots of money and keep all that money to themselves, they end up having to come up with a unique process or a unique product from this cannabis plant. And in their big human egos, they think they can improve upon the perfection of thousands of years of nature and this gift that she's provided us. So to me, a lot of not only CUD, but CHS as well, I feel like is more closely related to these products that have been human altered, and they don't look anything like our natural plant. And for myself, I've used the natural plant product for 11 years, and I haven't had any problems with CHS or CUD. So I really believe this is linked with a lot of the really high potency isolates, the synthesized compounds that are basically a chemical whipped up in a lab. Those are the culprits to a lot of these issues.
So I guess it's important to mention that this disorder only comes with THC, right? You can't get cannabis use disorder from taking CBD on a regular basis or CBG on a regular basis, right?
I mean, if the physician is illiterate enough, potentially.
I guess.
I could see that happening, actually.
I know a lot of my patients find it, somewhat alarming when I mention to them, that the cannabis plant has over 140 cannabinoids and only one of them is intoxicating. Only one of them can get you high, per se. And people are like, oh, and, when it comes to cannabis use disorder, I guess they're just talking about THC.
You would think so. I don't know. I mean, daily use is pretty much written in there with, taken often, spending a lot of time obtaining, or using cannabis or preparing it. That can, I mean, a lot of these parameters, I know they're written in with a negative connotation, but when you really take out the meaning, they're not all impairments. You know what I mean? They're not all reflective of a disorder. So I think there needs to be a little more nuance with that. I do believe there are patients who are not using cannabis appropriately, for sure.
100%.
But how is that any different from patients that abuse pharmaceuticals? It's not. And we don't have a pharmaceutical use disorder. I wish we did. That would be an excellent add to the DSM.
Yeah, I love that. I love that.
Yeah. So, I mean, I feel like there's just more nuance. And if you don't understand this science and you don't understand the plant, you're not one that should be diagnosing patients. And in fact, I go so far as to kind of chide medical professionals that if you're in a legal cannabis state and you don't know this information, you have a responsibility to refer that patient to somebody that does, in order to uphold, the ethics of autonomy and informed consent and beneficence, risk versus benefit. That's not being done on a routine basis here for our patients in the US. So
yeah, and if you feel you've been wrongfully diagnosed with a cannabis use disorder, you do have the right to challenge your diagnosis. So just to keep that in mind, many of the doctors that I met in Virginia were like, yeah, no, I will be challenging this diagnosis 100% just to reduce those numbers as well. The high potency cannabis is definitely a huge conversation, that we've been talking about when it comes to cannabis use disorder. And I think it's a really good segue too into our next topic about cannabis hyperemesis syndrome.
Yes.
Yeah,
what is cannabis hyperemesis? I have a hard time even pronouncing it. So CHS, we often hear about it, right? And it's this. It apparently results from regular or chronic cannabis use, and it causes intractable nausea, vomiting, cyclical vomiting, and relief of symptoms seem to be taking a hot shower or a hot bath, and that it will resolve itself once you stop using cannabis. I personally feel like these new high potency products, these superhuman altered products that we have access to, like isolates and distillates, that they're certainly influencing the number of cases of CHS. We're often seeing CHS also in young adults, I believe, and what are young adults doing? They're partying. They're gaining access to super high potency products to get really ripped, and then developing this syndrome. So, Jay, do you want to dive in a little bit more into CHS and explain it to us a little bit better?
Yeah, for sure. Well, I'm taking some of this information from Cannabis because they have a great breakdown about cannabis hyperemesis syndrome. And given that cannabis has been used for millennia and is currently, utilized by millions of people worldwide, at Cannabis, they say it seems illogical that a condition with such distinct symptoms like cyclical vomiting relieved by hot showers was not documented before the late 1990s. We have talked about that these are newer terms that we are hearing, cannabis use disorder, cannabis hyperemesis syndrome. And that explains a lot, I think, about, these high THC cultivars that are coming out, and all of the other, as Janna put it, bastardized cannabinoids and products that are flooding the market. I also take personal issue with, the legalization market and the irradiation of flower and the, whatever herbicides, pesticides, nutrients, anything that's chemical that's going into my plant medicine, I don't particularly want. And I would believe that that is having an impact on our medicine as well. We weren't doing this, before legalization, not in this way.
Yeah. Yeah, I agree. I feel like all of these things are impacting the rise. Sorry, I have a friend fly in the room with me.
Yeah, I've seen them fly by a couple of times.
Yeah.
They're aggressive this time of year. They know they're short timers.
Yeah, exactly. And I'm sitting in the greenhouse, so they're
Oh, it's so pretty though.
So, Janna, you've written a few articles on this. You've done some research into these altered products. Can you dive in and share some of your knowledge?
Yes, and so this really explains why we think this specific type of product is more closely affiliated with issues like CHS and even potentially CUD. If you have an unbalanced cannabis use, you're more likely to suffer functional impairments that are totally optional. You could totally probably get the benefits without that impairment. So we know that whole plant cannabis products that are concentrating the cannabis flower with the final product containing hundreds of compounds work very, very differently from the human altered products. And as an herbalist, I've learned this as well, that foundationally herbalists believe that the whole plant is always best. And we look at other examples of plants that have been isolated, or a single compound in the plant is taken out and synthesized to make a pharmaceutical, what the result of that is. And another good example would be valerian root. Valerian root in its whole form, very safe, very effective, helps with sleep, can reduce anxiety. Well, they've removed one isolated compound in the valerian root plant from this vast profile and synthesized it and turned it into the drug we know as Valium. And that conversion, what it did was reduce the medicinal properties. It increased the risk factors. It increased the horrible side effects. It just made it a less safe and less effective medicine choice. And so the same thing is happening with cannabis. And I realized this as a grower who had gotten used to whole plant extracts that I was using myself, my daughter, the patients I was serving. And in 2015, I began working for a CO2 supplier as a nurse consultant to help their patients with dosing and, assessing their considerations and screening their pharmaceuticals, things like that. So working with that product line, I very, very quickly realized those products were not the same thing that I was used to. And I, me, curious, hungry brain, I deep dove, went into the research. And what I found is that the research agrees. And there are actually comparative studies. This one that I'm thinking of was for seizures, where they compared the outcomes of whole plant cannabis CBD versus an isolate CBD for seizure management. And what they found was that the whole plant cannabis worked much better with fewer side effects and more predictable outcomes at like 75% less of a dose, which is cost savings for patients as well. So,
Absolutely.
Whole plant for medical use is just a complete no-brainer. And I'm sure we'll link that article as well, so you all can read into that. We also have evidence, really strong evidence, that human altered products don't boast the same unsurpassed safety profile as our whole plant. And there was a meloxicam case study that was written up in 2020 about a patient in the US who was mixing meloxicam and NSAID anti-inflammatory pharmaceutical with CBD. They both share the CYP450 pathway, and this is what heightens the risk of potential interactions. And, that combination can either heighten the efficacy of the drug, or it can block it out, or somewhere in between. So it's not all the same, but it is something we look at when we do a consultation with a patient, because it is I would consider the primary risk of cannabis use is interaction with pharmaceuticals. And in this case, the patient had been using a whole plant CBD, doing fine, and she switched to a liposomal isolate CBD formulation that boasted heightened bioavailability, meaning it was easier for the body to utilize it directly in its form. And somehow that, even though she had no problems with CBD and meloxicam, which, by the way, if I had consulted with this patient, I would have told her to space those out by the half-life of the meloxicam to reduce any interaction potential of that shared pathway they use. She did fine on that, but when she switched to liposomal, 3 days later, she began to exhibit a known side effect of meloxicam called Stevens-Johnson syndrome. And within 1 week, she had passed away from Stevens-Johnson syndrome. And it's a horrible death. You can think it's not caused by bacteria, but if you think of what it would be like to die of flesh-eating bacteria, that's basically Stevens-Johnson syndrome. So we know we have a strong indicator here that when we're changing the plant profile, we're also reducing its safety profile. So this is a really important topic. And like we're talking about, it does seem to be these high potency concentrations that are linked with CHS. There aren't a lot of good options to treat these patients. Oftentimes they have to quit THC permanently. We are finding that things like CBG cannabigerol, which is another cannabinoid in the plant, or the acid form CBGA may be beneficial in treating CHS. And there's even a group of nurses in Southern California that are treating CHS using psilocybin and other psychedelic medications. So we're still kind of trying to figure out how to bring comfort to these patients. But once again, once you get your receptors flooded to that point, we haven't figured out a way to scrub them and start over so that patient can use therapeutic THC again. So it is, you do risk being able to have that as an option as well.
Right. I'd like to go back to your point about drug interactions and just bring to light the fact that one of the most common side effects of pharmaceutical drugs is nausea and vomiting. Right. And I have a patient that I've been working with for about 8 years now, and he takes a boatload of pharmaceutical medications, all of which have the side effect of nausea and vomiting. But he recently came across, there's a case in Canada about someone who is suing one of the licensed producers for not having notified him that CHS was a possible side effect. I personally don't believe that it's the producer's fault, that it should be the prescribing practitioner to let the patient know that the medication that they're prescribing has potential side effects, but that's besides the point. This patient suddenly said, well, I've had nausea and sometimes even not necessarily full vomiting, but, dry heaving, retching. And he suddenly thought, do I have CHS? And so, we walked through it. And I think the importance of looking at the pharmaceutical medications and talking about the interactions and, the interactions between the pharmaceuticals that he's consuming and the cannabis are, again, that heightened, absorption, right? So that means heightened possibility of side effects. So we need to be very leery about these things as well. Do you think that there are any other factors like lifestyle, diet, genetics?
Potentially. We are getting pretty close to finishing a map of the endocannabinoid system genetics, and there are, some potential issues there. It really speaks to the fact that individuals may respond differently to cannabis, and some may be more sensitive to THC and suffer that, that receptor inundation more quickly than others. So that, very potentially, I don't think we've really linked it with other lifestyle factors. I mean, I would think maybe the combination of cannabis and alcohol could expedite it.
Yeah.
I really think the take home here is that if you're concerned about CHS, stick with whole plant products and you should be okay.
Yeah. And, to that point as well, because Uwe Blushing from Cannakeys, he also talks about this diagnosis of being somewhat speculative, not fully evidence-based, and that we frequently assume that cannabis is the sole cause in absence of any other causes, which kind of stretches, scientific reasoning, especially to the point of where we've only learned these terms in the last couple of years, but we've been utilizing cannabis for thousands, if not millions of years.
Exactly. Yeah, it's something that has shifted in our society, and I think we're whittling it down to it being, the bad players in the industry that are insisting on serving their wallet over patients and not really following what is best for medical use. Instead, they're capitalizing on all of this hard work that patients have done for so many years to gain access to cannabis again, and they're running with it to try to fill their wallets. And I just, it's disgusting to me that unfortunately that's very, very common especially in the US in the industry. So
Sure, profits over patients. And
Yeah, we are definitely not for that. Well, thank you so much for all of your thoughts on CUD and CHS. We're going to take another commercial break and then come back for our Awoke Dose.
all right. Thanks, Janna. All right, welcome back to ECN Talks. We are here for our next segment, which is the Awoke Dose. And what we are offering is a little tidbit of education, information. Today, we're talking about cannabis use disorder, cannabis hyperemesis syndrome, and what we believe is contributing to these. So we're going to share a little bit about how you could maybe avoid that.
Well, I think the first thing is to remember that we all have these endocannabinoid systems and they are responsible for balance, right? So we think that when you're consuming cannabis, you should take this balanced approach. So consider why you're consuming. Is it beneficial to your overall well-being, or is it impeding you in any way? Consider what you're consuming. Is it clean? Does it contain pesticides, herbicides, other contaminants like molds or mildews? Has it been irradiated? Like much of our government regulated products are radiated, which are, that's a means for trying to put safe products out there that don't have contaminants like molds and mildews. But what does the effect of irradiation have on the plant? Is it a whole plant product or a full spectrum product? Or has it been really altered by humans? Is it an isolate? Is it a distillate? We seem to be seeing that these type of really highly humanly altered products are potentially contributing to these types of diagnoses. Also consider when you're consuming. Are you consuming to calm yourself after a long, stressful day? Is it to help you escape from and forget your worries? Do you have other tools to help you through these situations? These are important questions to ask ourselves and, create intentional use with your medicine. And also, consider the impacts of your use. Are they always beneficial, or do they have some negative impacts? At ECN, we strongly, strongly believe in utilizing what Mother Nature has to offer in her wisdom. She's given us many plants that can support our well-being. And in our wisdom as humans, we have, I'll say historically speaking, we have learned to, in herbal practices, that using the whole plant is really the most beneficial way to using plant medicine. So, we encourage you to do this, to consider using the whole plant and consuming the smallest effective doses will help you avoid having any types of side effects.
Absolutely.
Yeah, so
Minimum effective dose, and that entourage effect of the multiple cannabinoids, definitely the way to go. When it comes to growing cannabis, when people want to push those THC levels, they're usually stressing out the plant, right? To get those high THC levels. I don't want stressed out medicine in my body. They say you are what you eat. Well, you are what you inhale too. If your animal is stressed out, that converts into the meat that you're eating. And if your plant is stressed out, well, that converts into the medicine that, you're absorbing as well. So that's important to me. It might not be important to everybody, but it is important to me as a medical patient, 100%. And we are in that lovely season of growing. It's Croptober, and everybody is getting ready to harvest those beautiful flowers that they've been growing. We have a couple little harvesting tips for you. Consider getting yourself a jeweler's loop so that you can check for trichome readiness. That is going to let you know when your plant is ready. It'll also help you pick out any mold, mildew, or insects that are infecting your flowers. THC and CBD are both said to be at their height of potency when their trichomes are cloudy, not clear. So this is when it's ready. A lot of people say, oh, wait till you have some amber, but amber is a little bit more conversion from THC to CBN. You're going to get still a wonderful medicine. It might give you a little bit more of that sedating feeling because of that conversion to CBN. So keep that in mind. We like cloudy trichomes. And then if you do discover any mold or bud rot undesirables, you might want to consider just getting rid of those. And if you want to salvage them, if it's all you got and, you're hoping to make a topical or something like that, you can even consider washing your flowers in some lemon juice. I use hydrogen peroxide mixed with water myself. It helps to, kill some of those undesirables and leaves you with a nice clean product so that you can, have a clean medicine to utilize and avoid these types of diagnoses.
Yeah, exactly. And we especially, encourage you to get rid of those moldy buds for inhalation.
Absolutely.
Like JJ was saying, please, if you need to salvage for topicals, even ingestibles, our guts can handle a lot, and processes like decarboxylation can help kill things off. But don't smoke moldy weed, please.
Yes, please. All right. So we'll leave you with that wonderful piece of wisdom and advice, and we will be back. At EduCanNation, we believe education is harm reduction. The more you know, the more you can enjoy the benefits of cannabis safely and effectively. To elevate your level of knowledge, join us next month as we chew the cud together on the many strategies available to transform your health and wellness with the support of our plant ally, cannabis. In the meantime, visit educanation.info so you can follow us on social media, subscribe to our newsletter, or join our organization so you never miss a show, a series, or a soundbite. EduCanNation is a nonprofit dedicated to responsible cannabis education, working alongside a community of members, advisors, partners, and sponsors. Our mission is made possible by the collaboration of volunteers and the generosity of our listeners. If you've learned something from us, we invite you to consider supporting our work through a donation or sponsorship. Your contribution allows us to continue delivering unbiased, stigma-free, science-backed information, empowering you to make informed decisions that nurture the health of your endocannabinoid system. ECN Talks is brought to you by EduCanNation and the KGL Network. If you are interested in being a title sponsor of this show, please reach out to us at educanationinc@gmail.com.